Thank you for joining us. I'm here today with Dr. Niall Roche, Director of Rheumatology at ValleyCare Health System, and our subject to discuss is gout. So if we may start please by telling our audience what gout is.
Gout is a common form of arthritis which is caused by inflammation in joints. And this inflammation comes about because crystals of uric acid are deposited inside these joints.
Okay, and why are these joints getting extra deposits of uric acid in the first place?
Uric acid circulates in the blood. It's a byproduct of breaking down food, particularly purines, which come from protein. And everybody has a uric acid level. But if the uric acid level is high, the crystals of uric acid may form inside the joints. The white blood cells in the body then react to that and produce what we see clinically as a gout attack.
Okay, and what part of the body is affected by gout? Is it the hands, is it feet, hips?
Most commonly, it can affect, it's usually the big joint of the first toe.
Okay, actually I believe we have a slide.
Yes. What you'll notice here, this is a typical patient who perhaps went to bed perfectly well and then woke up with severe pain, almost often maybe going to the bathroom, unable to put his foot to the floor, and you see that there's redness, it feels very warm to the touch, it's exquisitely tender, and this can last for several days. In many cases, these sort of episodes can simply resolve, but they can recur. And if you've had one gout episode, you're more likely to get another at some future point.
I didn't realize that. So gout, unlike other forms of arthritis, gout comes and goes, but it's not an ongoing, persistent condition?
So gout typically patients can have an initial episode, and after that the course varies. Some people have one particular episode. Sometimes a patient who's in hospital, because of the metabolic upsets after major surgery, they can get a gout attack, but they'd never normally have an attack. Whereas other people will go having one attack and another, and then other complications can form as well.
I see. So if you have this increased level of uric acid, are you not necessarily going to get gout?
The commonest predictor of a gout attack is your uric acid level. But people can have a gout attack when they have a high uric acid level, a normal uric acid level, or even a low uric acid level. And sometimes it's a sudden change in the uric acid level in the blood that causes the crystals to form and causes the subsequent gout attack.
Okay. And what other parts of the body besides the big toe are affected by gout?
As you come closer to the center of the body, so the foot, the ankle and the knee will be the next commonest, but you can have attacks in the fingers. Generally it's the extremities, and people often ask me, why would it affect a toe? And the answer is interesting, because as you leave the center of the body, the temperature cools. So the furthest away part of the body is the big toe, and that's why the gout, the crystals will form there because of the drop in temperature.
I see. And is gout found more in men or women?
Generally speaking, it's more common in men, but the story of gout is changing somewhat. If you go back maybe 30, 40 years, the ratio of men to women was much higher than it is today. It would have been maybe something like 20 or 30 to 1. Now today the ratio is something more like maybe 7 to 1.
Why would that be?
There are many factors. One is that people are living longer. And generally speaking, gout affects young men. So somebody who's in their 30s or 30s to 40s will be typical age to start getting gout attacks, usually in men. Okay. Women are protected until after the menopause, but when they reach about the age 60, then their ratio becomes more equivalent.
Then all bets are off.
All bets are off, and also people are often using the same medications, which is another risk factor.
I see. And are there certain races or certain body types that are more prone to gout than others?
I think gout is found worldwide. But certain races, for example, people from the Philippines, have a particularly high incidence of gout. And there are probably some genetic factors that play into this. I think diet is another important component. So people who eat a diet which is rich in meat are more likely to have gout than people, say, who have mainly vegetarian diet.
I see. That's interesting. Now, someone comes into your office, let's say, and they have this horrible pain, or they have a foot that looks wicked like that foot did and terribly painful. What can you do for them immediately?
Well, the first consideration is to make sure that you relieve the pain and the swelling and they can become mobile again. Frequently this can be done in a couple of days, so we give them an initial treatment. My favorite treatment is to give prednisone initially because it gets a great response. There are other drugs which are used.
And that's a steroid?
Prednisone is a steroid. Okay. So steroids are the most powerful anti-inflammatory drugs we have, and this is an inflammatory response. Therefore, if we suppress the inflammation, the pain goes away. So simply treating the pain is not as effective as getting rid of the inflammation, which causes the pain.
I see. And how does one do that?
Well, patient would go on a tapering dose of prednisone, initially maybe 10 to 15 milligrams. It depends a little on how severe, how large the joint is, how severe it is, and how long it goes on. I often say to patients that they should think about inflammation as coming from its Latin roots, which is from inflammare, meaning inflames. Now, if something's inflamed, if a fire breaks out, it's much easier and better to treat it immediately and use an adequate amount of water rather than sort of treating little by little. But even without treatment, many attacks will settle. Other drugs which can be used are things like non-steroidals, things like people often have tried Motrin or Aleve, or even prescription non-steroidals like Indocin. The problem is that those drugs are associated with side effects, for example, gastrointestinal bleeding, which may be worse than the problem they come in with. So I sometimes find myself saying to patients, you know, you don't want to, no matter how painful your toe is, it won't kill you. But if you start to bleed internally, that's a whole different question.
I see.
So you've got to weigh treating the condition with the risks of over-treating, perhaps.
Okay. And so when someone gets gout, that first episode, it's horrible. Now they know what to do. They've taken the prednisone. Are you going to see them back 6 months later? Are you going to see them back 2 weeks later? In terms of when is this going to happen again?
Well, I think that's a great question, because as I explained to patients on their first visit, and the first visit is great because you've really got their attention. They're there.
Scared.
They're scared. They're in a lot of pain, and they really want to know what to do. Mm-hmm. And the interesting thing is that when you find a patient with gout, you can look at it two ways. One is a very narrow way, where you say they have a problem with their toe, we'll fix their toe, we'll lower their uric acid, and that's the end of the problem. But it goes a little beyond that, because gout keeps bad company. When you have gout, very often you have other conditions like diabetes, the patient's overweight, they may be deconditioned, and they may have high blood pressure, they're at risk of, they may have high cholesterol, so it travels as bad company. And I often say to them, in a sense, you're fortunate to get gout, because if you get gout, it gets your attention, it gets you into the doctor, you can get checked. And I would much rather treat a patient by turning them into a healthier version of themselves than simply focusing in a very narrow way and taking away the symptoms that they come in with.
I see. So then what would you recommend for someone to do to prevent getting gout in the first place?
Well, part of the initial assessment is to look for these other, what are called comorbid or additional conditions which are present. And sometimes in the long run, they're far more serious than the gout.
I would imagine.
Gout, as you may see in some later slides, gout can cause some significant damage. But these other conditions like diabetes, high cholesterol, may cause conditions like a heart attack or something years down the road. So education is key. Explaining to the patient exactly how the attack begins, what you can do once it begins, and what other things you can do to change your lifestyle. So an example would be when the patient has the acute attack, we'll perhaps focus for a moment on the initial attack, you need to make them comfortable. Now, if you consider that the crystals which cause this problem, crystals of uric acid, I think we may have a slide of some crystals to look at here. They're like very sharp needles, as you can see here. This is looking at crystals under polarized light under a microscope. Now, imagine that on your bedroom floor, somebody sprinkled needles, pins and needles.
No, thank you.
And you had to walk across them. So these are actually already inside the joint. So every time you put weight on this joint, if you run, if you walk, each time you're actually damaging other cells nearby. The white blood cells attempt to get rid of these crystals, but they can't, so they break down, and in doing so release all of the things that lead to the clinical signs of a gout attack.
I see. So this is a picture basically of what the inside of someone's toe looks like.
Yes, if you were to take fluid out of a joint which has an acute attack and look at the fluid under a microscope, this is what you would see.
Okay. So after they have been having that initial prednisone, things are going a little bit better. Does it continue to look like this, or does that basically clear this up? Usually
the attack will settle, and you now want to be careful that they don't get a second attack. So certain things, for example, alcohol is a risk factor, and strangely enough, it's beer is more likely to cause an attack than, say, wine or spirits.
Why is that?
It's just a different type of, it has a different effect in the body. It raises the uric acid level more than wine does.
Okay.
Even though the alcohol content is lower, but there are many mechanisms by which alcohol causes gout, and the dehydration is just one of the factors. In addition to that,
foods and drinks?
Other foods, then, people eating a lot of meats, particularly things that people don't eat so much nowadays, like organ meats. So, for example, people eat liver or kidneys and things, done a little less nowadays. Those would put you at much more risk of gout. But it's not confined simply to meat. Chicken, fish can cause this as well. Certain kinds of fish, sardines, anchovies, these are more likely to cause gout than perhaps other fish, like, say, salmon. And it's due to the content of the puree and how the body handles it. But it's important to know that not just meats and alcohol can cause this, but even certain vegetables. For example,
you just can't escape this thing.
It's a little hard to escape, but you can divide foods up into those that are high in purines, those that have a moderate purine content, and those that have a low purine content. So in the high group, you'd have things like we mentioned, organ meats like liver and kidney, and alcohol will increase your uric acid level quite a lot. In the middle group, you've got things like maybe fish and chicken and certain kinds of vegetables. Beans, for example, can do that. And the lower, you've got leafy green vegetables, salads and things. The very healthy foods cause less gout than other things. The best thing to do for that is possibly go online and check. There are lists of foods, and because people have different diets, it's better for them to look and see what they may be eating, perhaps, and not realize is high in purines.
Okay.
So diet is one component. And the other aspect of diet is that patients are often overweight, and if they can lower their weight, first of all, it takes the weight off the joints. And as we mentioned with the crystals, the less weight that's pounding into those sharp crystals, the better, the easier it is. So losing the weight, adopting a different lifestyle is very much a part of controlling not only the gout, but all these other conditions that often go along with it.
Okay. Now with these, uric acid obviously is the big concern here. I know people go and they get their physicals and they check for cholesterol and they check for triglycerides and they check for all these things. Is uric acid one of the normal things that's measured in the course of a blood test? Or
no.
What would cause someone to even want to do that in the first place?
If they have a family history, if they've had a gout attack, of course, one of the things we always look for is uric acid. And just a word of warning about this, the fact that your uric acid level comes back normal doesn't mean you can't get a gout attack. There are many people who have a high uric acid level, a condition called hyperuricemia, where they don't get attacks. We're not quite sure why this is, but they can go around for years with high levels and not get attacks. Other people can get attack even when the uric acid level is normal, or even when the uric acid level is low. And we think that it's often when there's a change, perhaps a sudden change, which could be caused by something like, say, after surgery or an illness or a change in diet, say a crash diet or an alcohol binge, anything which rapidly alters metabolism will increase your likelihood of upsetting the balance in the body and leading to a clinical attack of gout.
I see. Now, we talked a little bit about how younger men get this, older women get this. You actually had been telling me before the program about a woman that you had come in, an older lady with...
Yes. I had a lady who's 90 who had gout.
For the first time she had gout at 90?
This was the first time that she was diagnosed with gout. She'd had gout for quite some time. And I believe we have a slide of this lady's hands. It can show you the sort of things that can happen. And what you see here, this lady who's 90 years old, in her right hand over here you can see that the little finger has huge collections of uric acid crystals. These are called tophi.
You can actually see them through the skin.
It's actually bursting through the skin.
Wow.
And left for long enough that will destroy the joint completely. I'm happy to tell you that after a few weeks of treatment, this lady's these tophi, these collections dissolved, and this is the same lady, her hands, after treatment. And she was very happy. She's 90 years old, and it made a big difference to her quality of life. There were minor changes, other tophi, apart from the very obvious one, in other joints. And I believe we have a before and after photo that may show, just to remind people what we saw. So you see, not only have we got, if I may, this slide, this breaking through the skin here, but several of these other joints are affected. But down here, all of the joints have improved, and she was happy.
That's amazing. So, now, was she in a lot of pain in the first slide?
You know, surprisingly little, even though, but an open wound like that is prone to infection. So she's at risk of, this can really complicate things. And certainly, if you go around with this level of, involvement, you're going to destroy the joints eventually.
Absolutely. Okay. So is surgery ever something that you need to do to fix gout, or is it really just curable with...
No, there was a time when they would remove, if for example, you get a tophus, and these collections of uric acid can occur in various body parts. If it's causing a problem, say it's adjacent to an important organ, then perhaps you might go in and do something. But unless you correct the underlying problem, the tophi come back.
I see. Yeah. So let's say someone's not willing to give up their beer, they're not willing to give up their steaks, they're going to eat what they want to eat, they're going to do what they want to do. So they get gout, how often? Every 2 weeks, every 6 months, a couple times a year?
Gout, in many ways, I say to patients, in many ways it's your friend, because it gets your attention. There are very few people I know. I mean, if you've ever had a gout attack, it's exquisitely tender. It's so sore and so limiting. People can't work, they can't do their normal leisure activities. They're very limited. So you have their attention. Almost everybody will decide, they'll modify their lifestyle. But there are some medications that can help to lower uric acid as well. And these are taken on an ongoing basis to prevent the attacks from arising.
And how well do they work?
They work well. Until relatively recently, the most common drug in this class was a thing called allopurinol. So allopurinol will lower uric acid level, and as we mentioned, the best predictor of gout is how high the uric acid level is. Mm-hmm. So if you can lower the uric acid level with allopurinol, very often patients do very well. Allopurinol has been around for a long time, 40, 50 years. It has some minor side effects, but sometimes it can have severe side effects, and we have to be particularly careful when we use it in patients with any kind of kidney damage. We're very fortunate. The first new drug in 40 years, febuxostat or Uloric, has come along recently and is much more effective than allopurinol and can be given even in patients who've got kidney failure. So it's a huge new drug in our armamentarium, and we're very pleased that in 40 years we've finally got another drug we can use.
You know, that's not very frequent. Is a lot of money and time not spent on gout research?
There has been a lot of time and money spent on gout research, but not by comparison, say, to rheumatoid arthritis or osteoarthritis, which are more common. So it makes sense that the research dollars tend to go to the common diseases, but understanding the underlying mechanism in any one condition often sheds light on other conditions as well. So the more we understand about what happens in osteoarthritis, in rheumatoid arthritis, the more we also understand what's happening inside gout.
And do these diseases or these conditions ever coexist? I mean, if someone has osteoporosis, are they more likely to get gout, or do they really have nothing to do with one another?
Well, you can certainly have more than one form of arthritis. I frequently on a first visit will say to people something that they don't know, which is there are many, many different kinds of arthritis. There are over 100. Of which about 10 are common. Yeah, the commonest of all is osteoarthritis. And certainly we do see patients who very commonly have more than one form of arthritis. So the commonest ones you would see together will be osteoarthritis with gout.
Okay. So someone has been living with gout, they've been maintaining a fairly healthy diet, they've been avoiding their beer and other alcohol. How easy is it to live with gout in terms of lifestyle? Do you have to make a lot of lifestyle changes?
If there are other conditions, if the patient is in generally good health and is a good lifestyle, they may not need to make very many changes. But obviously, the more comorbid conditions there are, the more severe they are. If somebody has high blood pressure, and very often, by the way, the medications they take for blood pressure, for example, diuretics, they'll help your blood pressure, but they increase your uric acid excretion, and then you can have, not only can you get gout attacks, but you can also end up getting other manifestations of gout, for example, kidney stones. So the uric acid normally is excreted through the kidneys, and stones can form in the kidneys, and then they try to make their way through a tiny tube that connects the kidney to the bladder. If they get stuck there, you get a kidney stone. People, they will never forget an episode of a kidney stone. So there are a lot of ways in which gout can affect somebody's life.
Okay. So I guess the whole purpose of this is to tell people to not get it in the first place. It sounds like no good can come of this.
I like to tell people that gout is their friend, and the reason is because it gets their attention.
It's not sounding like it.
Not quite, but I think it gets their attention. It brings, very often young men in particular don't go to the doctor unless there's a problem. Mm-hmm. And we know that nowadays the best medicine is preventive medicine, and often they are unaware not only that they have a high uric acid, they don't realize that their cholesterol is high, they don't know they have high blood pressure. They may be aware that they're overweight, but and they may also tend to develop disease like diabetes. So modifying the diet and improving exercise and losing weight not only helps them not to have gout attacks, but actually can change their whole way of being.
Okay.
So I like to think that as a result of having gout, they may end up ultimately being a much healthier person.
I see. And what advice would you like to leave our audience with as a close?
Well, I think that first of all, be aware that gout is common. Particularly if you happen to get an episode of gout where there's no trauma or something, you get an episode of pain in a joint that there's no preceding trauma. And it's typically the toe, the foot, the ankle, the knee. If you get any form of arthritis, it's best to go see either your primary care doctor, who may refer you to a rheumatologist for specialist treatment. It's good to know that it can be diagnosed relatively easily. There are very effective treatments available, and ultimately you may end up being a much healthier person because of this misfortune that has happened.
Good to know. Thank you so much for sharing this information with us, and thank you for joining us.